the scene now a year and a half ago. As you know, there was a lot of media coverage of its fearsome nature. In Philadelphia, we worked very hard to calm people down. And we were fortunate that the initial part of the epidemic hit at the end of the school year. So we did not have large numbers of schools with large numbers of children absent. We had a couple. And we responded in those schools and in those communities to educate people about prevention because we didn't have a vaccine at that point. We knew when the next school year began, so we had the summer of 2009 to talk with the school district and think about what we would do in terms of immunizing children and mandates and other things. The discussion at the Board of Health, the discussion that we had with the school district made it clear that no one believed that we should mandate this vaccine because by July or so, when the Centers for Disease Control began to tell us that we would have vaccine in the fall, it was clear that the virulence of the infection was not that high. At the same time, we were clear that we would at some point receive vaccine. It was likely not to be terribly planful. We were right about that. And when we received vaccine, it was going to be important that over a very brief period of time, we immunized a large number of people. So about half of the, or a little more, between half depending on the population, half and 3/4 of the high-risk populations in Philadelphia were immunized in an incredibly short period of time. The Department of Public Health distributed more vaccine over that period of time than it has in certainly anyone's memory. However, we were hamstrung by the fact that the schools in Philadelphia had not immunized children in more than 3 decades, and it's probably more than 4 decades. And as a result, there was no infrastructure in the schools, public schools, to immunize. We were clear that in order to do the immunization, we either needed to have the school nurses. There is a nurse for every public school in Philadelphia. We are advantaged in that way compared to a number of other places around the country. But it meant that school nurses who had not done immunization in school would have to quickly be trained. Their union would have to be worked with. Everybody would have to be on board. We'd have to be able to supply them. There'd have to be security. We'd have to figure out where to store it. We'd have to maintain the temperature. All of the infrastructure that has taken years to create in offices around the city, doctors, nurse practitioners, offices, didn't exist in the schools. So instead, the Department of Public Health and the school district came up with an arrangement whereby the department paid for and transported vaccine to schools. And we had at least one day at every school for initial immunization, and because children needed 2 immunizations, we went back a second time to schools. So it was a major undertaking. The reason that we said yes was, 1, we didn't know what would happen. 2, in the event that this virus had been more virulent, it would have been really important for us to be able to get to schools. And we felt that if we didn't do this, we would have lost an opportunity to create a model to distribute vaccine in schools in Philadelphia. So part of the reason we did it was so that in the future we would be more prepared should the next